Good morning to all. Good morning. It's very nice to see all of you all set to give great answers for this PG, no, it's a nursing students quiz. So do you know why we are doing this today? Yeah, so March 3rd is World Birth Defect Day, okay? So it's celebrated all over the world as Birth Defects Day. It's a very important day because birth defects are a big public health problem, okay? And we as pediatric surgeons, our branch specialized into a super specialization because of the management of birth defects. So that's how pediatric surgery separated from adult surgery as a separate branch, because a newborn is not a miniature adult. Okay? So it requires highly specialized care to manage them well. So that's why birth defects are a complete different problem altogether. And of course, as you know, the numbers of birth defects in India are huge. Okay, so that's why we are here today. And all of you are nursing students. And I'm Dr. Karmarkar, as I said, I'm a consultant pediatric surgeon at the Leelavati Hospital in Mumbai, and also the founder trustee of the Spina Bifida Foundation. Okay, so this is a foundation which works for the cause of neural tube defects or spina bifida. With me is our co-chairperson, Dr. Snehal Deshpande, who's a pediatric physiotherapist, and Dr. Tissini Joseph is a pediatric neurosurgeon, and Sneha is our chief coordinator. So they will be helping us to conduct this quiz. Okay, so I think, let them come. Yeah, so Sneha is worried about the gifts which are going to come, but we can always give you the gifts to the winning team in due course. So we have made teams, yes. Okay, so Tissini, a quick round of names or team-wise. Okay, so a quick, just go through, introduce yourself in 2 lines. We can start from this end.
Team A. Could you name yourselves, please, all the participants?
Good morning to all. My name is Monica. I'm from MSc Nursing student first year.
Okay.
Good morning, sir. My name is Sonali from MSc Nursing first year.
Good morning, ma'am, and good morning, all of you. Myself, Yogesh Sharma, and I am from MSc Nursing first year.
Very good morning, all. Myself, Shikha Pawar from MSc Nursing first year.
Good morning, all. My name is Vijay John. I am MSc Nursing student second year, Pediatric Nursing Specialty.
Good morning. My name is Ram Gopal Sharma. I am MSc Nursing student.
Good morning to all. I am Pritika Thakur from MSc Nursing second year from Pediatric Specialty.
Good morning, everyone. I am Riya Chaudhary from BSc Nursing third year.
Good morning, everyone. I am Divyanshi Yadav, BSc third year student.
Good morning, all. This is Vartika Sharma, BSc Honors Nursing third year student.
Good morning, all. My name is Sonia. I am BSc Nursing third year student.
Good morning, everyone. I'm from College of Nursing Shivani, BSc third year student.
Good morning, all. I am Mamta Kumari from BSc third year student.
Good morning to all. I am Kiran from BSc third year student.
A warm morning to all. I am Jeevan Jyoti from BSc Nursing third year student.
Good morning, everyone. I am Nidhi Sharma and I am BSc fourth year student.
Morning, all. Myself, Lakshmi Chaudhary, BSc fourth year nursing student.
Hello, everyone. I am an MBBS intern. My name is Alapan Das.
Good morning, everyone. Myself, Pranita from BSc Honors Nursing fourth year.
Good morning, everyone. Myself, Anisha. I am from fourth year BSc.
Okay.
Good morning, all. My name is Shelly, and I am doing MSc Nursing first year, Pediatric Specialty.
Good morning, all. My name is Meena. I'm BSc Honors Nursing third year student.
Good morning, all. My name is Sunita, and I'm third year BSc Nursing student.
Good morning, all. Myself, Neha Rishna, BSc Nursing fourth year student.
Good morning, all. I am Kajal, BSc Nursing fourth year student.
Good morning, all. BSc Nursing third year student.
Hello everyone, I am Ayushi from BSc Honors Nursing third year.
Good morning, all. I am Karishma from BSc Nursing third year.
Good morning, all. Myself, Nisha, BSc Nursing fourth year student.
Good morning, all. Myself, Renu Bala from BSc fourth year nursing student.
Good morning. Good morning, all. Myself, Ritu Yadav from BSc Nursing fourth year.
Good morning, everyone. I am Dr. Pulkit Bansal, currently working as intern at AIIMS New Delhi.
Okay, done all the introductions? Yes.
Okay. So I am Dr. Tisni. I'm a pediatric neurosurgeon and I practice in Kerala. Okay. So I'm associated with the Spina Bifida Foundation and I've come to see what the new generation holds here.
Hi, I'm Dr. Snehal Deshpande. By profession, I'm a pediatric physiotherapist and I'm actively involved in whatever we do to spread the word of Spina Bifida and associated defects.
I'm Dr. Suresh, fetal medicine specialist from Chennai. I work in the area of prenatal identification and treatment of birth defects. And I'm associated with the Spina Bifida Foundation.
No, we'll have. Okay, so I think let's get going because we need to wind up by about 10:30. So we want to make full use of the time. So I think in team number 2, there's one medical student, right? There are two in the same team.
B and team C, they have
B and team C.
Yeah, medical students.
So we'll see. I mean, they may have a little advantage, but so they will not answer in the first go. We will see if nobody answers, then, or we'll have some separate questions for them. Let's see how it goes. And before we start, I would like to introduce Dr. Deepti Agarwal, who's from the WHO, and it is because of Dr. Deepti that this whole program is being facilitated. Dr. Deepti, please come in front. Okay, so the first question to team A, and I don't know how you're going to answer, but I think one of you may raise a hand there.
Yeah, one member from the team can raise their hand. Okay?
Who knows can raise their hand, so we don't...
You can discuss and finally give the answer. You'll have 30 seconds each team.
Okay, so Dr. Tisini will keep track. So the first question is quite obviously, name the first 2 or 3 commonest birth defects in India. Name a few commonest birth defects. You have to name at least 3. At least 3. Quick, quick, your time is running out.
So thank you for the question. First one is congenital heart defect, then neural tube defect, then spina bifida, hypospadias.
So 2 may be right, but the third is not. Hypospadia is not very common, not amongst the top 8 or 10. So your 2 answers were right, congenital heart defects and neural tube defect. Okay, but hypospadia doesn't fit into the commonest. So Tisini, what do you want to do? Part marks or go?
So cleft lip and palate.
Okay, fine. I think cleft is correct, so we'll give it to you.
Yeah, we'll give it to you.
Okay. So the top 3 are, or 4 are CTEV, and that's going to be the next question for team B. What is CTEV?
Congenital talipes equalis pedis. Okay.
Not yes, please say it again.
Whoever is convinced of the answer, they can say it. You don't have to ask somebody else to say.
Congenital talipes equinus varus.
Okay, fine. Yeah,
Okay, we'll give
we
this.
can give it. So it is also known as what? The common term. Club foot. Yeah. Okay. Good.
Okay, third
Okay, for
question, Team C.
Team C, what are NTDs or neural tube defects? What do you know about them? What are they? Describe neural tube defects.
Sir, entities are a group of congenital birth defects which can be classified as cranial neural tube defects and spinal neural tube defects. In cranial, we can have anencephaly, or which can be further classified as hollow anencephaly or microanencephaly. Then we have cranioraschisis. Then in spinal, we have spinal bifida, occulta, cystica. So these are some of the due to that is due to either a defective fusion of the neural tube and or maybe there is some fusion defects or some
Destiny will give it to them.
Yeah, we'll give it to them. They've given quite a lot of answers.
Yeah, you can keep talking about neural tube
Yes.
defects for a few hours, if not more. But I think we'll give it to them.
Very good. Yes.
Okay. They are also keen to answer. Okay, I think.
Okay, we'll add
Destiny.
you up. Okay,
Okay,
so that's
the
Team
next
D.
question can be to them.
Yeah.
Okay. Can we have this slide shown? So this is to the additional team. There's a picture will come up. You have to tell us. Please don't prompt anyone. You have to tell us what this is.
Team D, somebody can raise their hand and give the answer for the team.
Can we shut these lights here a bit? Please get up and answer. Anencephaly. Okay. Pretty good.
Okay.
What do you know about anencephaly? Take the mic. No, you can answer in the mic. What is anencephaly? Okay. Yeah, quick. Describe anencephaly.
Sir, some part of brain is not developed.
Some part.
Some.
Okay, so it's basically the brain is not developed. So you see the head in that picture which you saw, the whole cranium is, flat. So one more corollary question which can maybe go to team A. So is anencephaly compatible with life?
There is one more team, the other side.
We'll go to them. This is for team A. Is anencephaly compatible with life?
No, it is not compatible because brain is exposed
Who's
to
answering? Okay,
Team A.
it is
not compatible because brain is exposed to the amniotic fluid, and when the baby gets
okay.
born,
Question is passed to team B.
Just say yes or no.
Yes or no?
It's not compatible with life.
Pass to team C. So of course the answer is going to be.
There are
Okay.
no marks for this. You
Can
just
we
say yes
show
or no.
this slide, please? So it is compatible with life. These kids, these can be born alive. One sec, let me put a slide show.
Shift the slide.
Okay. So here is a happy family with a child with anencephaly, and these children are born alive, but they won't live long. So it's not compatible with long life, but they can be alive for 4 days, 5 days, 1 week. And so this family, although they knew that this child is anencephalic, they chose not to abort. And they said, whatever, even if it's 7 days with our son, even if he's anencephalic, we want to enjoy those 7 days. So this is a happy family picture. The youngest kid with the mother is the anencephalic child. So a lot about what you think of birth defects depends on your attitude as to how you look at them. Okay, so you can think spina bifida maybe is terrible defect and the glass is half empty, or you can think that it's half full and these children with spina bifida have minds which are completely normal and can become doctors and nurses like all of us. Okay? Okay, let's go to the next question.
So this question will be for team E.
For
there.
team E.
Yeah.
Okay. Maybe a little difficult question or not, I don't know. What is the prevalence of neural tube defects in India? You know, you understood the question? Yes? Team E. Team E, Team E.
Just give an answer. One of you can rise up and give the answer.
Even if it's wrong, just answer.
Yeah, 10.
So we can decide.
1 in 30,000.
30,000. Pass to which team?
Team A.
Team A. Pass to team A. Go ahead.
4.5 per 1,000 live birth.
4.5 per 1,000 live births. Okay.
Who's answered?
Team A.
Team A.
Okay. Teams. You're also in team A, right?
So that's right, Tisini.
Yeah.
Yeah. So it's about more than in India. Globally, if you see the other countries, it's less than 1 per 1,000. So 0.7 per 1,000. So in India, it's high. It's about more than 4 per 1,000 births. So which would mean more than about, yeah, good answer. More than at least 25, 30, 40,000 children born with neural tube defects or with spina bifida each year. That's a large number. Okay. Question to team B. What are the causes of neural tube defects?
Folic acid deficiency.
Okay. So are all neural tube defects due to folic acid deficiency?
Exposure to some anticonvulsant drugs like sodium valproate.
Okay.
Radiations or due to genetic.
Valproate and carbamazepine.
Okay, good. I mean,
that's enough, right?
Any idea how many are folic acid dependent, I mean, caused by folic acid deficiency? How many of neural tube? The other causes are also there, but if you give enough folic acid to the mother to be, how many can be prevented? How many neural tube defects? Okay, this is an open question. No,
we can prevent around 70%.
Yeah, 70 to 80% with folic acid and B12. Okay, so yes, so you are writing the marks, no, Tisini? Okay, let's maybe who's next? Which
team C?
Okay. Okay, this is maybe a little tricky question. What is Pierre-Robin syndrome? Pierre-Robin syndrome. Team C. Is it team C? Yes. Any idea what is Pierre-Robin syndrome?
It's it has a constellation of symptoms, and basically there are some facial defects like retrognathia, some ear defects, microtias, some flat nasal bridge. Exactly, I don't remember the sequence, but
one more major component. You have said retrognathia, which is correct, and sometimes ear defects, not so common, but one more important feature of Pierre Robin.
Underdeveloped jaw.
That is microretrognathia, is same. So if you name that one more feature, we will give it to you.
Macroglossia.
Backward shifting of tongue.
No, that is part of, that's not a defect. Because there's retrognathia, the tongue goes back. But one more component, which can commonly be there. No, we'll pass on to team D. Team D,
Sir, jaw defect.
if you answer that additional component, half marks to each. No, pass on to team A. Team E, sorry, team E. One more component of Pierre Robin syndrome. Okay. Team A, team B, whoever wants to answer.
Team A or team B? Whoever wants to answer.
Okay, probably none. So we can give half marks to team B or C. C. The component is cleft lip palate. Okay, as a part of Pierre Robin. Okay, so let me go to, can we show the slide again, please? Okay, so this is not a question. This is obvious. Okay, what it is. Can you all see this? Yes. This is cleft lip, cleft palate. Okay, but okay. So whose turn is it? Team D.
Team D. Yes.
Team D. What is smile pinky? I will give you a hint. It is related to cleft lip. Tough. This is not, I mean, it is related to cleft lip, but not strictly a medical condition or something. It's something else.
Sir, it may be related to the treatment of cleft lip.
It's related to teeth.
To make them smile.
No. Okay. Anyone knows what this is?
Free surgery for cleft lip.
It's not a medical.
It is a foundation which works for cleft plate and cleft lip.
Okay, so that foundation is Smile Train. Okay, which you're talking of. So many people do know about Smile Train, but Smile Pinky. Okay, anyone has heard of this? Has anyone seen this film? Okay, on cleft lip and cleft palate patients. Can you put on the slide? Okay, so this is an Oscar-winning documentary, right? Made on cleft lip palate surgery on a girl from UP. Okay, quite famous. I mean, a lot of medical students and doctors have seen this film. So, okay, let's go to the next. Who's next? Team? Yeah. Okay. Team, which one?
Team E.
Team E. What is TOF? Okay. Any one more TOF or TEF that you know? Okay, I think very simple question.
Yeah.
Okay.
Next question to Team A.
Next to Team A, how is tracheoesophageal fistula diagnosed? Okay, before that, how many of you have seen a case of tracheoesophageal fistula? Just raise your hands. Okay, almost all. In this institute? Okay, yes. So this institute used to have the largest number of tracheoesophageal fistula cases some years back, about 10, 20 years back. Now I don't know how many cases come here because in those days only few centers used to operate on these cases. Okay, come back to question. How is TEF diagnosed?
Team A.
We put NG tube and take X-ray. If NG tube is not proceeding towards the stomach, then we consider that it is like some obstruction or like fistula is there.
Yes, so you said you put a NG tube.
Yes.
And what?
If NG tube is not proceeding towards the stomach, and then we consider that
Destiny, we can, I think, give it to them. Hemanta, yes?
Yeah, we'll give
Dr.
it to you.
Hemanta is a pediatric surgeon from Dibrugarh, Assam. And so he also does a lot of TEFs. How many have you done so far? Maybe 100, thousands?
My God.
Yes. Fantastic. So if you go to the West and say that you have done 700, 800, I mean, they will be aghast in their lifetimes, in their unit. Their entire surgical team may not have done more than 200. So that in India is, the experience that surgeons have is huge. Okay. Let's go to the
Team B. Next question.
Okay, can we put on the slide, please? Okay, so team B, no?
Team B.
What is this?
Is this AIIMS?
What is this? You see the what did you say?
There is retroflexion of the neck and
Diagnose. I want the name of the birth defect.
So is this AIIMS? AIIMS?
No, we can pass on to team C.
Team C.
Amelia.
No, none. No guesses, nothing.
No, she said, spell it out loud.
Amelia. There are no limbs.
Amelia.
What?
Amelia.
Amelia, no. Team D.
Sir, it may be kyphosis.
Pardon?
Kyphosis.
No, so kyphosis, no. What is
Team
this?
E?
Is the okay, team E. Yes
Yeah,
or no?
just give the answer.
No, I think they are clueless.
Okay.
Team
A.
A. Okay, so anyone? Yeah, come on. You can, even if it's wrong, you can mention. You might be right by fluke.
Encephalocele.
No.
Sir, can we try once again? Team B.
Okay, but you may not get marks.
Is this cleidocranial dysostosis?
No. This is a very simple defect. Okay, I'll give you a hint to team B. It is a defect of the lymphatic system.
Is it cystic hygroma?
Correct. Yes. So very common situation of cystic hygromas is the neck, no? Neck, axilla, and such a huge swelling. How did you miss the swelling? Okay.
I think the picture is slightly deceptive. A little lower down, they could have found out probably.
Yeah. Okay. So I think no marks for this question. Okay, we can put off the slide, please. Slide we can put off, yes. Next question to team C.
Yeah.
Okay. Maybe a related question. What is the treatment of cystic hygroma? No, I think, yeah, they're quite clueless.
Laser
But
ablation.
so we can keep this question
Yeah, you want
open.
to answer something?
There is.
Yeah.
Laser ablation.
So anyone who knows the answer,
Pancreatic enzymes.
raise your hand. Yeah?
Pancreatic enzymes.
Pancreatic enzymes. No, no, no. So there are two. Anyone knows the answer? No. So sclerotherapy, okay, injection sclerotherapy is one option. The other option is surgical excision. Surgical excision, you should have said, very simple, no?
Pediatric surgeons asking the question.
Yeah, the question, surgery. If you would have said surgical excision removal, it would have worked. Okay. Which is the next team?
Team D.
Team B.
D.
Team D. Name two common birth defects of the GI tract.
Sir, anorectal malformation and TEF.
And?
TEF, tracheoesophageal fistula.
Okay. So, yeah, maybe, but anorectal malformation is correct. TEF may not strictly come because we've already discussed it, and gastrointestinal. GI is gastrointestinal.
Sir,
Esophagus is not part of it.
Sir, omphalocele, gastrocele.
Okay, I think we can give it. Yes. Okay.
So the next question to Team E.
To Team A. What is Team E?
Yes.
What is Hirschsprung's disease? In the yeah, I think correct. Good. Good answer. And it's the absence of ganglion cells in any part of the intestine, but commonly in the colon. Okay. And what is a symptom of Hirschsprung disease? Correct. So, and if they present later, if they present after 2-3 years, what is the main complaint? Constipation. Basically constipation. Okay, good. Next question to Team A. Is it? Okay. Name common birth defects of the kidneys. Name a few common birth defects of the kidneys.
3 defects if you can.
Lot of, within Team A, they have become 2-3 teams.
BUR, polycystic kidney disease, and PUJ.
What is PUJ?
Pelvic
urethral junction obstruction.
Good. So, yeah, well answered.
Yeah, very good.
Okay, so that brings me to another corollary question to Team B, maybe a little easier. What is hydronephrosis and what are its causes?
Sir, due to vesico-uretral reflux, there is progressive dilatation of the ureter and the pelviuretric system. Sir, obviously, most common cause itself is vesico-uretric reflux. It can be idiopathic or due to secondary causes like, as they said, posterior urethral valve, etc.
Yes, good. But you are a medical student, I know. Yes.
So he's given a good one paragraph answer.
But so what is hydronephrosis? What is it? Define hydronephrosis.
Sir, the reflux of urine leading to progressive dilatation of renal calyces and causing renal injury.
The reflux is a condition causing hydronephrosis. But what is hydronephrosis?
Sir,
for you, this will be a proper question.
Retention of urine in the kidney.
No. I mean, that is one effect. What is hydronephrosis? So, Dr. Suresh sees such cases before birth every day, maybe every day. So it can be hydronephrosis can be detected before birth in a fetus. But how do you define hydronephrosis? Dilatation of the pelvic calyceal system
That is
more than, I mean, generally it said more than 10 millimeters. Of what? 10 millimeters of what? Where's the other medical student?
Sir, the AP diameter of the
Good. You are which year?
intern, sir.
Intern. No doubt. So, the anterior or posterior pelvic diameter, okay, should be more than.
So we'll give it to team B, right? He's given the
Give
answer.
it to team B?
Yeah.
Okay, fine. But he mentioned only one cause. And, okay, but your decision is final. Okay. Dr. Suresh, would you like to say something about these fetal hydronephrosis or its management? Anything that you want to comment on?
Fetal hydronephrosis is one of the most common conditions we identify prenatally. It can be diagnosed from the early second trimester. But at each trimester, we have different cutoffs for measurements between 4 to 7 millimeters. But more than 10 millimeters, it is always called as hydronephrosis. Sometimes you can just have a little bit of stagnation in the kidney without any blockage. Most common cause of hydronephrosis is pelvic junction obstruction. Then it can be on one side, it can be on both sides. If it's bilateral, then we go and try to look for a cause more beyond the bladder, like post-urethral valves or something like that, where the bladder also will be big in size. So it's all a question of how much pressure is built up inside the system. Usually due to blockages either at the PUJ or at the PUV junction. Vesicoelactic reflux will also cause some hydronephrosis, but that will be much more milder. Whenever there is a block, because there is pressure, the calyces will always be opened up. So when we use the word hydronephrosis, it means the calyces will always be dilated. So this is what we need.
Okay. Can we have the slide again?
Team C.
Team C. Okay. Can you see this picture? So identify what is this and what is done with it. Not the medical student, the others have to answer. Intern is prohibited from answering this. Others can answer if they know. What is this?
Patient.
Yes, correct. Good.
Correct. 20 marks.
But no, and where is it? What is done with it?
Sir, in case of hydrocephalus, where there is obstruction, so we can put the one end in the ventricle and other end in the either peritoneum, so that the drainage occurs and the ICP is reduced.
Okay, good. So now we go to one more slide, and this. Can you see this slide?
This
Everyone?
is for team D.
Okay. And no, so we'll keep this, Tissini will keep this question open for medical, yeah, mostly medical, but if some nursing, wait, she's already raised her hand before I've asked a question. I think you knew the slide of what? So this, I'm going to give you a hint. This slide is related to neural tube defect, okay? You have to tell me how these three images are related to neural tube defect. Don't answer. If you know the answer, raise your hand. Anybody from any team. How these three images are related to neural tube defect. Okay, there are two from team A and one from team C. Okay, anyone else? Achha, all teams have one person. So, team A has to. No, but whose turn was it, Tissini? Team D, but I don't think anybody has. Can we go back to the slide? Okay, Tissini, whose
Okay, we'll go in the order. Team A, you can go first.
Only one person per team has to answer, not 2, 3 answers.
So who's answering? Team A?
How are these 3 images related to neural tube defect? Quick, come.
Discuss.
Only one person, huh? No revisions.
This picture depicts lemon banana sign, which is the characteristic feature of meningomalocele.
And third picture, the green.
Green leafy.
All 3 pictures, how are they related? What is that green thing? So your 2 things are correct.
Then this is also folic acid, this green leafy vegetable.
Okay, fine. I think we'll give it. Very good.
It was very good.
Okay, so we can go to the next slide, which is a corollary.
Team E's question.
Team E's question, what is this?
It's just
First-
a black and white image, maybe.
Yeah. So first tell us, what is this image? What is this? It is a what type of image? It is a ultrasound, right? What ultrasound? It is an ultrasound of what? And when was
Okay, we'll move on to Team A.
Team A? What is this?
Sir, it's a lemon sign.
Correct. And fetal ultrasound showing the fetal skull. Okay? Okay, let's see if we can persist with the slides.
I think we should.
Okay. Team, which is team? People have? Yeah, no problem. Till 10:30 we have to continue.
Okay.
Next team. Team B. Team B.
Team A. Team A's question.
Again Team A?
Yeah.
Okay.
They have been answering all the past questions.
Okay, fine. What is this? And name it. Name specifically what it is. Generally, what are these? And specifically, what type? You can, general term, of course, everybody is quite simple. What are these conditions generally called, and what is this specific type?
Okay, you should start answering now.
Or we can pass it to Team B.
Sir, these are conjoined twins or Siamese twins, and the specific condition here seen is thoracopagus because their bodies are fused.
Okay, thoraco-omphalophagus. Okay, correct. I think we can give half those pass marks.
Team B's question.
Okay. This is, let's see.
Constricted dilated pupil.
Can you see this well?
Yeah, somebody has given an answer.
Which team?
Yeah, Team B, answer. Yeah, green dress, you can answer.
Constricted or dilated pupils.
Constricted or dilated pupil?
No.
Okay.
Globoma of iris.
Okay, pass on to Team C.
Globoma of iris.
No.
Globoma.
What is this?
of iris.
Okay, first let me tell you, this is a birth defect. Okay. So think of birth defect. Glaucoma is not necessarily a birth defect. Team
It's
C, no?
coloboma.
Team C, quick.
Coloboma of iris, not glaucoma.
No. Next, Team D.
Team C.
C हो गया. नहीं हुआ.
Team C, anybody?
She answered, no? Yeah, Team C. Team D, quick.
Retinopathy.
Retinopathy. No. Team E. Perfect. Aniridia. Okay. So team A, who's next now? Aniridia is what? What is it? Absence of iris.
Williams
See,
syndrome.
these are two eyes of the patient. One has the iris, one doesn't. Okay? And so sometimes these, do you know what other conditions aniridia may be associated with? I think you have seen my slide. This is Wilms tumor. Show the slide, please. Yeah, so see this is a huge Wilms tumor in the same patient. Very good, but I'm impressed with your, not this. Yeah. Yeah, you see this tumor of the kidney. Yeah, on this side. Okay. You can switch
Team
off the
C.
slide.
Team C's question.
Okay, so I think we are going to have 3 or 4 more questions. Okay. Okay, so what are PU valves? Who's
Team C.
Team
C.
C. What are PU valves? Not the intern. No. Don't prompt others. Okay, we can pass it to next. Pardon? Pelvic urethral valves. No, not correct. Pass on to team D.
Team E.
Posterior urethral valve.
Posterior urethral valves. Very good.
Okay. So we'll give it to Team C then.
Yes.
Okay.
Team D. Team D.
They answered. Okay. Okay. Yeah, Team C only answered. Okay.
Last
You'll
team.
get me killed.
Okay, so
Team
now.
D.
Okay, can we go to slide, please? Please name this condition. Can you see? This is seen better here. They have screens there also. Okay, great.
Team D.
Sir, cardiac atresia.
Atresia.
Team D.
Sir, cardiac atresia.
No, pass on to team E.
E.
Team E. Yes.
Team A. Team A. Anyone trying? Just raise your hand if anybody wants to try. Okay, Team B. 1 second. Team B.
Ectopia cordis.
Ectopia cordis.
Who's? Yeah.
Team C. Sorry, B.
That's good. So who was answered?
Team B.
Team B. Ectopia cordis. Was that the answer?
Yes, sir.
Okay, great. So last question of the day now.
So this is for all the teams because all the teams have had equal questions till now. So anybody who wants to answer, just raise their hand and we'll give the point to that team.
Okay, and this is, okay, I'm going to maybe put up, so 2 pictures, one after the other. If you answer the first correctly, we go to the next. Put on the slide. And, okay. Slide. Yes. So it is a medical student, no.
I'm not medical. I'm not medical student.
Duodenal atresia.
No, let's pass it.
Okay, Team B.
Huh? Okay, so not duodenal atresia.
Esophageal atresia.
Which one?
Esophageal.
Esophageal.
Yeah.
No. So what she said, Secondly is right. So this is not duodenal, but this is ileal atresia. Okay. So you can, what do you do? Half marks or no? No marks. No marks. No marks. Okay. Last picture. Again, open to all. Please raise your hand. One person from each team may be allowed to answer. No, whoever. No, so.
Prune belly syndrome.
Okay, very good. Okay, great. I think this was nice. I mean, I'm pleasantly surprised by the answers that you gave, especially this prune belly and aniridia and those three images correlation. So very good. I'm quite happy with what you are learning. Okay, great. Now I leave the tougher part to our chief coordinator and Tissini, deciding whom to give prizes and how. So my role is over. Over to Sneha and Tissini. Thank you.
So we have a tie between team A and team C.
One more question.
Do you have one more question, sir? One more question.
Tiebreaker.
Yeah.
Okay.
This is for team A and team C.
Yeah, we have some questions. Let me see.
Yeah.
Okay, so there's a tiebreaker question. Okay, let's go to the slide. Unless there's okay. Can we go to the slide, please? This is the last tiebreaker question. Tissini, please decide who's answering.
22. Altogether.
These are pictures of the same patient. Okay, some are antenatal and couple of them are postnatal. Only between the two tied teams.
Mesenteric cyst.
Wait. Tissini. Who's?
Is it
A and C. So is A answering?
Omphocele.
Okay.
Mesenteric cyst.
She has said mesenteric
cyst, yet you're saying?
Yeah, so omphalocyst is definitely wrong. This is not exactly omental cyst. This is a ileal duplication cyst. Okay, so I don't know, but they are closer. They are closer to
assist
to the diagnosis. So I think we'll give it to team C.
Team C. So team C will be the winner. And could all of you stand up in team C? We have some gifts for you.
Team C, one by one.
Yeah.
You can come here and receive your gifts from Snehal Deshpande, ma'am.
Uma, ma'am.
That's it. And Deepti also. Deepti madam. Deepti madam. Deepti madam. Please announce the name and give the gift. Photographer.
Yes, we have. Who's coming? What's your name? So this is Ritu. Karishma.
It is on one full, carton.
Yeah, he was doing
All the vidyarthis come here. Come, adjust. First.
पेपर ले लो मेरा, ये इधर से मैं जाऊं घर पे, मुझे नहीं रहता इधर, पता भी नहीं रहेगा मेरे।
Okay, smile, cheers.
She's removing a mask.
Okay.
एक ले लो without mask.
Okay, stay, madam.
नहीं, I'm good here. I'm good here. Let the kids be in the front.
Okay.
So Dr. Sir, they are doing really well. Yes. Sir should also give.
Sir, yeah.
Sir, please give.
Yes, yes. Dr. Rodrigo.
I'd also like to call on that girl. Can we?
Yes, yes, she was very good.
So, let us welcome Dr. Rodrigo and Miss Payden, who are the India Chief and Deputy Chief of WHO. So, we are very pleased to have them with us. Deepti, come, Rajesh.
नहीं उधर से उधर जाइए उधर
Just see that you are getting on.
come closer, come closer. Thank you. Okay. So some gifts will come. Whoever not taken, come.
My person
All of you.
is here, so I'll introduce him. So our person will come and we will answer this.
break for tea, chai, and get back here maybe in 10 minutes. 10 minutes, we shall be back.
Then sit on the seats behind. Have tea and come back.
I want to call upon a few more candidates who have answered well. That girl and the boy who was there, the medical student. Okay. Come. Can you pass this?
Let's extend a warm welcome to our chief guest, Dr. Bhagwat Karan, who's the MOS Finance, and a warm welcome. So, Sneha, please. Also acknowledging the kind presence of the Director of AIIMS, Dr. M. Srinivas, and the WHO India head, Dr. Rodrigo, the Deputy Head of WHO India, Ms. Peden, and my friend, Dr. Meenu Bajpai, the Head of Department Pediatric Surgery, who's also the Dean of Academics. Plus, we have a whole lot of panelists for our discussion, and I will introduce them as we go along, but I must acknowledge the presence of Dr. Sumita Ghosh, who's the Additional Commissioner from the Ministry of Health. Plus, we have a large number of experts on our panel today. Before we start the discussion, I think Dr. Srinivas would like to say a few words because I believe he has another pressing appointment. So, Dr. Srinivas, please. And then we'll go on with our program and talk about our topic today. But before Dr. Srinivas speaks to us, I must give a little background of today's meeting. Today is World Birth Defects Day, as you all know. March the 3rd is observed all over the world as World Birth Defects Day. And as pediatric surgeons, and you can see that all the 4 people on this side are pediatric surgeons. So we can not have a program like this today, especially in the most premier institute of India. And for that, the Spina Bifida Foundation is very, very thankful to Dr. Karad, of course, Dr. Srinivas and Dr. Meenu Bajpai for making this possible today, and the great support and initiation of WHO India through Dr. Deepti Agarwal, who coordinated this whole program with us. So again, a round of applause for all. So as I was talking about organizing this with some of the panel members and our coordinator, we were saying, well, we hold such meetings every year, and we've done that in Bombay and maybe other cities along in the past. But now is the time to not miss the forest for the trees. Meetings will come and meetings will go, but I think this is the most opportune situation where we have Dr. Karad in a very, very influential position, Dr. Srinivas in an equally influential place, and of course, Dr. Meenu Bajpai and all of us. So I think the sort of stars are aligned correctly for birth defects and their prevention to be taken up on a national scale. And so we hoped that this meeting will be a precursor or the harbinger for some of the very important public health measures that we need to take. So that is why this meeting probably will be a landmark meeting for pushing ahead the agenda of birth defects prevention, especially neural tube defects. With that short introduction, I request Dr. Srinivas to please say a few words. Dr. Srinivas.
Thank you, sir.
Well, you talked about the stars. I think we have a Dhruv Nakshatra here, Dr. Karad. Under his guidance, support, and all the protection and the guidance we are getting it, we will definitely move forward. And on behalf of the AIIMS, we definitely, whatever the programs and the initiatives which you want to take up, we will be there to coordinate with sir. With this, I welcome all the delegates to the AIIMS New Delhi, and I hope that this interaction will bring a lot of change in understanding and the guidelines, and then we think of what we can do together for the children of the country. Thank you very much.
Thank you, Dr. Srinivas. Honorable Minister of State, Dr. Bhagwat Karadji, the most respected, eminent pediatric surgeon of our country, my respected senior in the fraternity, Professor Srinivas himself, dignitaries from the World Health Organization, Minister of Health and Family Welfare, eminent panelist, Dr. Sandeep Chatterjee, President of the Pediatric Neurosurgery Association and a member of the Global Foundation. As we all know, as Dr. Srinivas mentioned and Santosh mentioned, every year March 3 is observed as a World Birth Defect Day to reiterate the commitment of the WHO and all countries for prevention, detection and treatment of these defects. Their incidence is staggeringly high, up to 3 to 6% reported from various sources, which also lead to about 3 lakh plus deaths annually across the globe just because of them. 1/3 of these are from the Southeast Asia region, and we all know it's an underestimate because not all of them are reported. Now, CNS malformations constitute the most common of them all. 2/3 of all birth defects are CNS malformation. Fortunately or unfortunately, a majority of severe CNS malformations, the fetal life is not sustained. They get aborted. And all this could be prevented if we take measures so that the metabolism which leads to these malformations is addressed. Now, there have been many measures for preventing defects, like for example, rubella per se, which causes many defects. It has been recognized, its vaccination is part of the national programs in our country also and many countries, which definitely brings down the incidence to a large extent. It has been recognized for very long that food fortification with folate can also prevent significantly the anomalies that neural tube defects stand. In fact, it has been observed that in those countries which have been able to successfully implement this has resulted in a fall in incidence of these malformation by 50%. So this is a huge potential. Unfortunately, this awareness and this application is only in 1/4 of those countries where it is possible, despite the fact that for 30 years we know that supplement by folate can actually prevent it. So awareness programs, applicability of nutritious substances, vehicles which can reach out to the mothers is all which is required, and that's where we want to reiterate these things. Now, the WHO in its several documents has clearly mentioned that prevention, detection and treatment is something which we have to go very proactively for. I've talked about prevention. Detection, there are many neonatal screening programs, and the screening programs not only detect the obvious structural defects, but also some of the hidden ones or subclinical ones, which includes deafness as well. So preventive measures and detection early has the way to go. The third component is treatment. As you know that since the availability of measures and other applicability, despite knowing folate can be preventive, is not all pervasive. So there will be births with defects. They would need treatment. 2/3 of our India's population is in the rural area. Imagine what is happening there. The pregnancies which are not sustained because of birth CNS defects, they are lost, leading to huge loss of health of the ladies, and that itself is a penny problem. So therefore, and the prevention, folate metabolism is required not only for preventing NTD, but many conditions, many thrombotic events take place because of rise in homocysteine levels, and megaloblastic anemia can happen because of folate deficiency. So imagine the cost to the exchequer, and it has been calculated in one document that it's about $30 billion of saving if for 1 year we can apply measures to prevent neural tube defects. So just any effort to implement a program, any effort to include this as a either awareness or supplement should be an investment from the government, because in the long term we can prevent huge neuromorbidity, requirement of renal transplantation, and so on, so forth. So with these words, I would say for the treatment, we as pediatric surgeons, as one of the motto of World Health Organization is that we should also see, and we were discussing it, in fact, Professor Dr. Karad many a times has taken up the matter to the Minister or Honorable Minister of Health also, not very long ago, that every district hospital should have a pediatric surgeon. I think for his effort, we should give a big round of applause for him. And this would be a very monumental step. And therefore, I consider even today's day as a momentous day. His presence per se in the anomaly for which pediatric surgeons, we are actually birth defect surgeons. Our 4/5 of our work is correction of structural defects in the children who are born despite all this. And therefore, his presence today in an effort where we can make efforts for prevention, detection, and treatment of these conditions is very momentous for our institute also. With these words, welcome all of you. I will now request the compere to request the panelists to discussion, and also I will ask Dr. Karat to say a few words after the initial discussion. Yeah, thank you very much.
Okay, thank you, Minu, for that opening comments. And yes, you highlighted a lot of issues concerning birth defects. So what we are now going to do is quickly start discussing some of the most important public health issues concerning birth defects, especially neural tube defects. And as we go along, we'll ask the various eminent panelists who are here to talk about those particular aspects. And then, of course, we will be keen to listen to our chief guests and invited special guests about what they feel about this whole issue, which is really a crying need and is overdue. So let me go to a few slides. Can we have the slides on, please? Okay, so I think this is seen. So today's our brief interaction is going to talk about neural tube defects and birth defects, why it's a top priority, the various specific public health aspects of which we need to address immediately. And so today's session is more a conversation, and a conversation between experts who have great experience in what they are going to talk about, and a conversation with Dr. Karad and the people from WHO who will take our message and our campaign ahead for getting some of the public health issues translated into action on the ground. And yes, Dr. Sumita Ghosh is nodding her head. So I'm hopeful that we go ahead with these. I'm not going to spend time on discussing types of birth defects, etc. Most of us here are specialists who are aware of these things. So let's go straight to what we are here for. I think as far as public health aspects of birth defects are concerned, these are 5 or 6 important things for neural tube defects at least that we need to look at, that we need to pay attention to. Prevalence of NTDs, it's the commonest birth defect. The numbers are enormous. So there are, and we'll have a look at that. The obvious socio-economic consequences of birth defects like neural tube defects. The burden again is huge. Public health, public awareness about neural tube defects and their prevention, non-existent in our country. You go to a wealthy, educated family in Mumbai or Delhi, or go to a tribal family from some hamlets across the socio-economic geographic spectrum, the awareness that folic acid can prevent such a devastating anomaly is non-existent. Birth defects registries, and we have Dr. Suresh with us, who's the pioneer in birth defects registries. So is a much needed thing when we talk about preventing and decreasing birth defects. Unless we know how many exist, we will not really get feedback about whether our measures are working. Along with awareness, which will lead to probably supplementation of folic acid for the large number of unplanned pregnancies. Fortification is something the world does for preventing neural tube defects, and much more coordinated efforts are needed for fortification. Last but not the least, for all the children born with a birth defect like spina bifida, treatment they need to have access to complete, proper and timely treatment, which unfortunately is not available. So I think these are the 6 important areas for public health, of public health concern as far as neural tube defects is concerned. Quickly, let's go through some figures. As I said, prevalence, and these are the 2 most credible references that exist. So we are talking of more than 1 lakh cases of neural tube defects, of which half will be anencephaly. So they may not really matter because they are not compatible with life. But the remaining half of about 40 to 50,000 cases are cases of spina bifida, which means 40 to 50,000 children born with childhood paralysis each year in India, of which a majority or 80% are preventable. So I think we have a great duty to perform by doing something about this as quickly as we can. And many people across the world, and one of the pioneers and ambassadors of neural tube defect prevention is one Dr. Godfrey Oakley from Atlanta. And he says, Santosh, now the pandemic is over, but do something about the neural tube defect epidemic. COVID is over, but neural tube defects is of epidemic proportions. And so we need to pay heed to that. This is a slide showing actual patients from across the country who keep ringing us on our helpline. The foundation has a national helpline, and each week we have 2, 3, 4 calls coming from all across India. Here are some actual pictures sent by these patients on WhatsApp. One good thing is the remotest part of the country, the person has a WhatsApp, has a mobile phone, and can transmit pictures. So here are pictures from Andaman, Orissa, Gujarat, Meghalaya, UP, Haryana, Karnataka, Goa, Maharashtra, just to name a few. So the problem is actually there on the ground, and many of these patients, I think all of them who contacted us, were clueless about what treatment is to be given. They said, we went to doctors at birth, they said nothing can be done, and some of them are having these back lesions but not getting proper guidance as to what should be done. From a public health and preventive health point of view, it is good to compare neural tube defects with polio, because when you talk about polio, everybody is aware. Today there are practically no cases of polio. Severity of paralysis in polio is much less as compared to neural tube defects. There are no associated problems and deformities. Polio is preventable, neural tube defects are preventable, but regarding awareness for neural tube defect prevention, I think zero. As far as polio prevention, every child in India knows pulse polio drops. So we had done a huge campaign for pulse polio, which was of course required, but maybe not on that scale and for so prolonged a time, but at least for a year or more, a public campaign for creating awareness about how to prevent a very serious, life-changing defect like neural tube defect is very, very much required. And I think I'm absolutely convinced that each day, each week, each month lost, we are looking at hundreds of families whose lives have changed. And we have with us two parents who are also going to quickly narrate their experience about bringing up a child with a neural tube defect. The socio-economic consequences of birth defects are obvious to this enlightened crowd, to this enlightened gathering. I need not mention how it affects the quality of life and the rest. So this of course is an obvious thing. As far as prevention, we all know that folic acid and B12 given to the mother at the right time before conception prevents up to 80-85% of neural tube defects. Unfortunately, nobody outside this room in the lay population is aware of this. And so therefore it is on our shoulders to see that we facilitate a national campaign to make people aware of this. So in short, what we need to do is well known. Get enough folic acid in the blood of mothers who are to conceive, of women who are going to conceive, and in every pregnant woman before conception. The problem is half the pregnancies are unplanned, half are planned. So for the planned pregnancies, if the woman is aware that a tablet needs to be taken before conception, it will take care of that. The unplanned pregnancies, if there is fortification, I think that will take care of that. So as far as awareness and fortification is concerned, it is not this or that, it is both. So it's not which is first. So a national awareness campaign, Dr. Karad, is something which should be and is a national top public health priority for our country. Okay, so with this I'm going to now include some of the panelists, and we may take few open questions. So at this, before we start with the other panelists, Dr. Meenu, would you like to say a few words at this stage?
Well, I can only say that the most important part and challenge which is facing us is that, as you very rightly mentioned, unplanned pregnancies and lack of awareness. And therefore, we should think about two things. One, when to introduce the medicine and for preventive measures, and what should be the vehicle which is easy. Because in our country, there are regions which are rice staple diet regions, and there are wheat staple diet regions. This particular macronutrient is also heat labile. So therefore, the challenge is what vehicle we should use so that it reaches out to everyone, and especially the girls as they are growing up. And secondly, at what time and what platform we should begin with it. I think we should revolve our discussion to a big extent around this also. Other things science is trying to sort out, but I think for us, this I would consider as a big challenge. And the other challenge about having pediatric surgeons has already been addressed by Dr. Karad, and definitely he will touch upon this point again. Thank you.
Okay. So we were talking about prevention and awareness. And before we go to other few public health aspects, if there's any quick comment about awareness. Dr. Rajesh Mehta has been associated with the WHO and has worked in this area. A quick comment, Dr. Rajesh.
Yeah, thank you, Santosh and Honorable Minister. Since we are talking about science here, we just heard supplementation can prevent, but it's a very human behavior related intervention that the lady has to start before conception and continue for subsequent 3 months into the pregnancy. So taking tablet every day is a big challenge of compliance. There is no country in the world who has been successful by using supplementation alone to prevent neural tube defects.
Yes. So
on the other side, 57 countries in this world are doing fortification, large-scale fortification with mandated WHO standards, which India is not doing. India is investing so much in rice fortification, sir, presently. It is part of government's initiative to supply fortified rice, but the level of fortification with folic acid is 13 times less than the WHO recommendation. So we have to change those standards to bring that level of folic acid into public distribution system, that we have large-scale programs effective for both anemia and neural tube defect.
Right.
And cost effectiveness
Dr.
is proven.
Rajesh, sorry to interrupt. Yeah. I mean, we also are going to talk about fortification in a little more detail, so we can address that. Again, as I said, it's not awareness alone or fortification alone. It's probably a mix of both. So just a couple of more points. One is about birth defects registry, which is again an important point. And I'm going to introduce Dr. Suresh. He is the leading fetal medicine. Yeah, sure. So, can we ask Dr. Suresh? He's from Chennai, from the Mediscan systems and the pioneer in birth defects registry. So, sir, if you can briefly mention about birth defects registries, because Dr. Karad also needs to know a little bit about that, and he also is in a hurry, he would like to leave. So, but yes, please.
Sir, the birth defect registry initiative, which we started in 1997, was primarily to identify where is our problem, which are the most common defects, and how can we identify them antenatally early so that these parents can be counseled in a fashion. So we started it as a passive registry, and almost like 298 hospitals across the country joined the registry. It was a simple mechanism where at the time of birth, whatever defects that were there, we gave a simple form to fill up and then submit it to us. So a geneticist with pictures, so that geneticist will look at it, a specialist will look at it and reconfirm and then log it in. And then we found that, for example, in Assam, cleft lip and palate was a lot. But neural tube defects was almost very high across the years. 25.2% is what we got as neural tube defects. And these were live births. So, but over the years, because of effective implementation of ultrasound and training, we found the antenatal detection of neural tube defects has become very high. Close to 70%, on an average, about 70% of neural tube defects are identified, even though the possibility is there for over 90% detection, even in the first trimester. So the live birth of neural tube defects has come down a bit because of antenatal detection and termination of pregnancy. But the incidence has not come down. because that is where this fortification and simplification. So this is what the registry will give us. If we are able to put the data in a very, very simple fashion, across the board now online digital is available. And we implemented this in rural Tamil Nadu as per Tamil Nadu government initiative, and we found it very, very effective. Currently, the Tamil Nadu government has started the initiative of birth defect registry along with UNICEF. They've just started the program, and Kerala has implemented this for cardiac defects, and they were able to bring down the incidence of death due to cardiac defects from double digits to a single digit by just linking with hospitals. Once identification is done, there will be hospitals will be assigned to that pregnant lady, and the hospital will take care of it fully, completely free of cost, of course, through the government initiative. So I think a birth defect registry is extremely important. It is not difficult now with digital. It can be done even on the mobile phone, very easily implementable, but decision must be taken for that.
Yeah, absolutely. So just in that context, just a quick comment. There is an effort along with FOXY, which is the prime organization of gynecologists, to start a birth defects registry, especially for neural tube defects via a phone app. And I think Uma Kalekar, who's the director of Mayor Vita Biotics, who is helping FOXY for that app. Where is Uma? Yeah, so maybe just 2 lines, Uma, if you can talk about the app that is quite likely to come around.
Along with FOXY. So Dr. Rishikesh Pai, you already have a discussion with him, and the app primarily is ready, and we'll be showing it to Dr. Karmarkar and FOXY members. And once the trial is successful, I'm sure that we should be able to launch the same.
Dr. Deepti?
Yes, sir. So just taking a minute to share that in the Southeast Asia region, WHO has already taken the initiative to establish a hospital-based surveillance system. And since 2014, the births are already being recorded. And as of today, there are 4.7 million births that have been recorded from across 11 countries, but mainly from 6 countries, including India. And they have reported 51,000 births with birth defects. And Dr. Madhulika Kabra, her WHO Collaborating Center for Genetics, is the final validation or the quality check center for the entire Southeast Asia region. And we also found that neural tube defects were the most common births.
Correct.
So I think there's a lot of effort already put in, a lot of capacity building done in the region. So all the new initiatives that are being started, if we could all align and contribute to a single database, that would be good, because there's already a huge system where a lot of quality, and let me say that a lot of government teaching hospitals are the ones who are contributing data into this surveillance system. Thank you.
Yeah, absolutely. So before I request Dr. Karad to talk to us, a quick comment as Dr. Deepti mentioned. Dr. Madhulika, you are quite in charge of keeping track of these birth defects, which I think data is sent to her to verify and collate. Yeah, so a quick word from you.
Yeah.
Dr. Madhulika Kabra is in charge of the genetics department at the All India Institute, and a very well-known name in birth defects and genetics research.
Thank you very much, sir. So, as Dr. Deepti said, this program is going on since 2014, and Dr. Rajesh Mehta is here, Dr. Deepti is here, they know about this, and the program is coordinated in our unit by Dr. Nirja Gupta, who is also there in the audience. She coordinates the whole program. So basically, there are 11 countries which are contributing to this particular surveillance system, and out of these 6 countries participate online in the form which has been built in, which is called NBBD, and some groups would report on neonatal database also, some would only report on the birth defect databases. And there are 5 countries which have their own system. their own systems, and they are using that particular system. So basically, India has contributed the largest number, being the country where we have large number of births. So basically, this is an online database, and our role as a WHO collaborating center is the quality assurance for this. And the first level verification is done by the centers who are participating. There is the nodal officer there. So in all centers, first level verification was earlier also not being done there, and we were responsible for that. But according to the program, we are the second level verifiers. So basically what is being done is that the data comes to us, and each forms are being checked where the data is incomplete. So we check for completeness, accuracy, and timeliness. And then if there is any discrepancy in the description or the coding is not correct, then the information goes back to the WHO, where they are coordinating the whole data. And then the information goes to the center which is participating, and they sort of correct it if possible and send back the data. So finally the forms are verified, and then data analysis is done overall and countrywide. So that's what is being done as a sort of coordinator for quality assurance in our center. Thank you.
Thank you. So just one or two more panelists left, so we can get two quick comments, because everybody, sir, would like you to listen for a couple of minutes. So we have Dr. Sandeep Chatterjee and Dr. Karad. I must introduce his pediatric surgery connection to you. He is Dr. Subir Chatterjee's son. Dr. Subir Chatterjee was the pioneer, as we all know, of pediatric surgery in India. Subir Chatterjee, R.K. Gandhi, and M.S. Ramakrishnan. And Dr. Subir Chatterjee celebrated his 97th birthday last week, and Sandeep Chatterjee and his brothers are carrying on. Sandeep Chatterjee is an eminent pediatric neurosurgeon and is an author in a very, very great book on pediatric neurosurgery. He is also passionate about prevention of NTDs, and he has come all the way from Calcutta for this meeting. Who? No, brother is, I don't know.
He's not a surgeon at all.
He's not a surgeon.
He's a physician.
So Sandeep is called to many places to talk on this issue. So your quick comments.
Yeah, so just, I was just going to say, on behalf of the International Society of Pediatric Neurosurgery, we wrote up a position statement about a year ago, which was published in Child's Nervous System. And 6 of us authored that statement, one from each continent, and I was chosen from Asia to be one of the authors. And so the International Society of Pediatric Neurosurgery recommended definitely fortification. And the reason was very simple. It was the fact that countries that had done fortification, so USA, Canada, Chile, South Africa, Brazil, Venezuela, the incidence of open neural tube defects had been reduced to close to 90% of what they were before. So there is clear evidence that this works in reducing this terrible condition. The second thing was there was a lot of criticism of giving folate fortification, which is the only way to do it, because supplementation will not work. As you well know, by the time the lady is pregnant and is detected as pregnant, it's too late to start folic acid. The criticism was, number one, the issue of possible neoplastic diseases that giving high dose of folate fortification may cause. Enough studies have occurred, including in the United States, where there was the biggest lobby looking at a possibility of developing colonic cancer if you gave everybody fortification with folic acid. It has been clearly shown that this does not happen. And in fact, the incidence of colon cancer is reduced in North America after fortification. The other criticism was that you can hide B12 and folic acid deficiency, vitamin B12 deficiency. Now, of course, we know we can assay vitamin B12, so that problem does not arise either. There is one other concern that has been raised, which is if you give high dose of folic acid, you might cause some cognitive impairment in some people. But again, that has not really been borne out. So given the fact that these children that have this condition have to suffer multiple surgeries, neurosurgical procedures on their spine, or pediatric surgical procedures on their spine, orthopedic procedures for their scoliosis, brain procedures for their hydrocephalus, renal procedures for their kidney. These parents just spend their entire life going from pillar to post. And the saddest thing is, if they have a normal sibling, that is completely ignored by these parents who are completely obsessed with the children with spina bifida. So since we are doing fortification of so many things in this country, we are providing fortified under the Anemia Mukt Bharat program. We are giving folic acid and anemia to women of childbearing age. But we're doing it on a weekly dose, which is very good for anemia, but not enough for spina bifida. It's just extending that and having, if we have, for example, we're talking about fortification. The easiest fortification now technically to do is salt. And you have triple fortified salt where you can spray iodine and folic acid onto the salt, and you have enough iodine in that salt. If we could have a fortified salt at least available parallelly with the norm, we are already having iodinated salt. So if we can just add folic acid, and technically that's very easy to do to iodinated salt, then at least we have this available for women of childbearing age. And if parallel with that we can have a national awareness program. We've had a press conference day before yesterday in Calcutta for Eastern India, where we've tried to launch a national awareness program also. Then women of childbearing age know they need to have this salt, even if all the salt is not fortified.
Thank you. Yes, so the food which is to be fortified needs to be universally consumed in the country. So salt is being tried on, and a big trial result is awaited from Ethiopia. So we are waiting for that to be published. But last quick comment from another pediatric surgeon, Dr. Hemanto Datta, sir, probably you have met him. He's from Northeast Dibrugarh, and he'll tell you about the exciting new food stuff which is being tried about fortification. So he'll talk to you about what that is in brief.
Thank you, sir. Because we have seen that whatever the USA experience regarding fortification of flour, that is not successful in India because equitable distribution is one problem. So we have seen that tea is one beverage which is widely taken by all Indians. I think most of the Indians, even adolescents, they take. So if we have done a pilot in Maharashtra and we have completed an RCT in Dibrugarh, where we have added folic acid and vitamin B12, and for 3 months, 1 milligram each. This is a replacement dose. 1 cup of tea daily, which is fortified with folic acid and vitamin B12, could raise the serum folate levels to a significant level. I think that is one of the areas that we can look into at the national level also. I think tea is one of the areas where we can fortify. And WHO guidelines, as well as which is again recommended by Food Safety and Standards Authority of India, that we have to look at multiple vehicles which can reach the most number of people across the country. I think tea is one area, tea is one vehicle which I think we can think of. And then we have seen positive results, so much as for in the pilot. And we are waiting for the RCT to come out. I think within a month or so, we'll come out with the results, outcome of the RCT. So I think tea is one of the vehicles which is very promising, and we can think of the tea as one of the fortification vehicle. Thank you, sir.
So a lot of interesting developments in fortification.
Right.
Mr. Sudhakar is our foundation, one of the co-chairpersons. He is a father of a girl with spina bifida, and she has been treated by us in the past. So he will narrate to all of us his experience about raising a child with a neural tube defect. In brief, can you your comments?
Yeah. So thank you, sir. It was a great fight in life to bring about a child, because three things will happen. One is, of course, the social stigma and all are different, but the availability of normal education. Some of the neural tube defect children could be normal mentally, but there is hesitance to accept them in the normal class. But still, I fought with schools and then sent the child to the normal schools at the normal age, in spite of urinary problem, stools problem, and even access. She has done a MA journalism and she's working today. But it's my request would be that there should be efforts to provide normal education, how incentive can be given to education institutions to accept such people. Second problem, of course, I have been, from the day child has grown, as child was growing, my economic position has grown. That's a different aspect. But it's not easy to afford upbringing of a defect child, because even small things like diapers, wheelchairs, catheters are so costly. So my recommendation would be that there could be efforts from government to produce them and supply them at a lower cost, while it will provide employment, it will provide opportunities for setting up industries, but it will provide the material for disabled persons at a cheaper cost. Awareness, yes, we were not aware. We are educated, both me and my wife were educated, but we were not aware of this. My recommendation for that would be, just as we are showing Mukesh Kumar film for smoking and drinking, I don't know how much impact it has got. Can there be a film division movie on birth defects? Every movie theater should project for at least 10 seconds, 15 seconds. That should be, there is a birth defect, everybody should know, and what is the thing they should do. And in 10th class science, can there be a chapter on birth defects?
Correct.
Everybody will read, and then awareness automatically comes. Every educated. Today, the birth defects are happening 50% in educated.
Surgery, rehabilitation, palliative care, psychosocial support services for mothers, children, their families, even teaching teachers. What else do you need? What kind of special attention for that child? Although our goal is really to prevent it, we need to take care of those that are affected. While reporting birth defects is included in the National Health Information System, it is important to sustain the Sentinel hospital-based surveillance that you've already heard. And it's really good that there may be apps, but let's consolidate it. Otherwise, we'll be alag-alag. Our surveillance will be one part here, one part there, neural tube defect, another birth defect in another, but we need a way to consolidate it. With that, as the movement to prevent birth defects gathers momentum, we love that many of the health issues, after COVID, health issues really become a community-owned issue. Whether it was COVID, a Jan Andulan, TB is a Jan Andulan, this one as well. Any health, I think health is a Jan Andulan. It's not just any specific disease. So on behalf of WHO, I really reaffirm our commitment to support however we would move to the next level, to the next scale, because that's the challenge of India, diversity and scale. And with that, we will still need a lot of scientific evidence, data for us that is localized, so we're able to strategize and take this step by step. Now, with that, we are so committed, Dr. Sunita knows this, that for us, our goal is to ensure every woman and child can survive and thrive. Thank you very much for your time.
Thank you, Dr. Rodrigo, for your comprehensive remarks. And yes, I mean, a lot of work is to be done ahead. This probably is a meeting which will spur that work. And at the end of the meeting, we are going to compile all the points that have been discussed and bring out a small draft resolution, which will be circulated to everyone here for accepting and then further follow up with the ministries. With that, I request our chief guest, Dr. Karad, to please say a few words. Kutuni, any?
Today, I am really happy to be a part of discussion in the panelists who have come from all over the country on the occasion of World Birth Defects Day. Today, for this panel discussion, the chief guest, or I can say the senior most person, Professor Dr. Bajpai, who is from this institution only, Dr. Rodrigo, who is representing WHO for India, Srimati Padden, she is a Deputy Chief of the Indian representation for the WHO, Sunita Ghosh from Government of India, is it? Yes. Then all senior peoples, all the way they have come from the corners of the different parts of the India, and Santosh Karmarkar, who is my colleague when I was doing pediatric surgery, he was also there as a resident long back. Anyway, first of all, I congratulate Dr. Santosh Karmarkar, who is taking very keen interest in the birth defects. After I becoming minister, within first month, he came to me. We had a long discussion. Then immediately I had taken appointment from Honorable Health Minister Mansukh Bhai Mandviya. We had a discussion with him, and he said, just you suggest me what is to be done, we will do it. But I think you have taken long time. 1 year after we are meeting.
Yes, yes.
We
will not
are
take
meeting
more time now.
We are meeting here. See, I am really happy because I am meeting very senior pediatric surgeons of the country, like Dr. Chatterjee. I think your father was a pioneer, like Dr. R.K. Gandhi.
Yes.
Barabar na?
Dr. Subir Chatterjee and R.K. Gandhi were contemporaries.
Of the pediatric surgery. Anyway, our government, means government of India, is taking efforts to develop in all sectors. I will give examples. Say I am in the finance department, although I am a doctor, but I am a MOS for finance. Now our economy is growing very fast, and we are the 5th largest economy in the world. When Honorable Prime Minister Modi ji has taken charge in 2014, we were on the 10th number, but now we are on the 5th number. Similarly, in digital transactions, we are in the 3rd in the world. Means our technology, our people are accepting the technology, they are using the technology. So digital technology, we are 3rd. Similarly, in health also, there are a lot of things, there is an improvement. And if you see the medical seats, undergraduate medical seats, they have increased by 75% more in these 7 to 10 years. Not only that, the PG seats are increased by 2 times. If you take the All India Institute of Medical Sciences, there were only 7 institutions up to 2014. Now there are 22, and the government is planning to increase 12, more 12 for All India Institute. Not only that, our planning is to have a medical college at 8 districts all over the country. So, and the budget of the health has increased, I will say, in this 9 years 3 times. So in all respects, under the guidance of Honorable PM Modi ji, we are doing progress, and this is because of the reforms, adopting new technology, going in details, what are the advantages, what are the disadvantages. So health is an important sector, no doubt, and today on the occasion of the World Birth Defect Day, we are going to discuss what are the problems, how to come out of this word defects of the child. So what I feel, as some senior pediatric surgeons have discussed, the prevention is that is a line, first line in the PSM. Prevention is better than the cure. So to prevent, I think the 2 things are important, just like hypothyroidism, there is a salt is done with the mixed with the iodine. Similarly, so what are the results of the folic acid mixed with the salt, that we have to study, as you have said, some countries are doing. So we have to study what is it, what is the outcome also. And if the outcome is good, then I will request Honorable Health Minister, I will take his appointment and we will have a discussion with him, and we will come for the solution, because this government is always ready for the reforms. As you said, Madam, MTP Act, I think you already told, no? MTP Act, I am really happy to say you that MTP Act amendment 1978 MTP Act was there, and this MTP Act amendment was done in 2021, means after a long time. But Honorable, at that time, Health Minister was Dr. Harshvardhan. Now, I being a senior doctor in the Parliament, I was supposed to talk on this, and I spoke for 25 minutes on MTP Act in the Parliament, in the Rajya Sabha. And at that time, Dr. Harshvardhan said, Ki Dr. Karad has told everything, so now I don't want to elaborate this more. But some questions from the audience or Parliament members, then you tell us. There were no questions. So similarly, just I want to tell you, whatever the decision comes out of this panel discussion for whole day, we will see that the government of India will be involved in this, and the decision will be taken. The second thing, as a prevention is important, the second thing, what we as a pediatric surgeons are doing daily basis, that is a management of the child who is born with the defect. That is, of course, health department is taking care of this, but what are the innovations in that? How we can improve the child with the defect, that we have to take care, and that we are going to discuss here. Third, I think, as I said, the role of the government comes in the prevention, and the role of the government comes in the third part, which I said is regarding if the disabled child is there, then what facilities government can give. That is also important. And there is a social welfare department in our country, in government of India, and that is taking care of the child, but we have to approach them. Similarly, as you said, can we keep some seat reserve for the employment in the private sector or government sector, that we can think. Or if the child with a birth defect, with some paralysis, but they want to do some business, so whether we can give some facilities from the government. Suppose he want to do the business, then suppose I'm giving example, whether bank can give the loan. If the loan is given, can we give the interest rate, little bit rate? So this can be discussed, but unless until these things are discussed, we come some conclusion and we discuss with the concerned minister, I think the problem will not be solved. I am sure that today is the occasion of World Birth Defect Day. You all from all corners of the country have come here. You are going to discuss a very valid subject, and with this, whatever the conclusions that already I told to Dr. Bajpai, we will discuss with the Honorable Minister. I will take his appointment, and I will see that the efforts you have taken will be fruitful in the developing or helping the child who is having defect, number one, and your efforts which you are taking will be helpful to prevent, to suppose 70%, 80%, the number of childs with the birth defect. He has told me around 50,000 child born every year with this spinal cord birth defects, spinal cord problems. So we'll try, and this is I will say, a service to the humanity. This service is a very great service, because when I was a student, it was said that at that time, the child, such child who are paralytic, who cannot walk, that they, after some time, it was there, abhi mujhe pata nahi hai, दे क्रश टू द पेरेंट्स ऑल्सो, मुझे कैसे बचाया, मुझे ऐसा इतना भी प्रॉब्लम होता है उनको, तो वो नहीं होना चाहिए। इसीलिए उनका लाइफस्टाइल कैसा अच्छा हो जाए, उनकी लाइफ में इम्प्रूवमेंट कैसी हो जाए, तो इसीलिए हम सब लोग बैठे हैं, हम सब लोग सोच रहे हैं, तो इसीलिए हमें काम करना है। और आई बीइंग अ डॉक्टर, पीडियाट्रिक सर्जन, I being a pediatric surgeon, I know problems of child also, and I am on the government side also, and I will see that the government will also do something better meant of this child, such child. With this, I thanks Dr. Santosh Karmarkar and Dr. Bajpai ji for inviting me and be a part of this discussion. And although I am busy with my work with the government, but always as a doctor, always I am with you to be a part of, to solve or to reduce such problems. Thank you very much.
Thank you so much, sir, for those really inspiring words. And we will look up to you for our continued campaign as far as prevention of neural tube defects is concerned. And I know that whenever we have approached him, he has been extremely accessible, and his coming here today is an example of his desire to help the community of doctors and the community of pediatric surgeons to prevent serious birth defect. So thank you once again. A quick, there are some mementos we want to give. आपके हाथ से एक फोटो आपके साथ मिल जाएगा तो they will be very happy. Quick, Doctor, we start with Dr. Binu Bajpai himself. So, to it from you. Next, come quick. Quick. Yes, whichever order, doesn't matter.
That's for Rodney.
Dr. Rodney. Go on. Dr. Sunita Ghosh. Please come. Requesting panelists to please come. We'll save some time. Dr. Madhu. Dr. Sandeep Chatterjee. Dr. Suresh. Dr. Kabra is running. Yeah, that's true. That's true. Mr. Sudhakar, the MoH&FW Foundation. Dr. Deepti, she was very supportive to the initiative from the field. Name is Dr. Rajesh Mehta. He has been working for this
Must be.
Last but not the least, to Dr. Karad himself. This is especially for this is again for Dr. Karad, especially from the All India Institute. छोड़ के Okay, please, requesting others to please be seated for 10 minutes more. Please be seated for 10 minutes more. We are going to end with a vote of thanks and some comments from whoever is here. If they would like to say something, comment before we close with a vote of thanks. So there are some senior pediatric surgeons, neurosurgeons. Any one of you would like to say a few words? Most welcome. Yeah. Dr. Deepak Gupta, neurosurgeon from the institute.
No, I just want to take it further from Dr. Santosh regarding how many people outside this hall actually know about awareness. So I think while the government of India is working on awareness, I mean, we have been working on awareness for last many years, but nothing much has happened so far. I hope it happens. I think we should be educating the doctors. The knowledge gaps which are there in our community, they need to be filled up. And it is our moral responsibility sitting in the public hospitals to produce doctors who know that when is the right time to start the folate supplementation. That's it. Thank you.
Thank you. So yes, the awareness. So it is the mission of the foundation for 2023 to do whatever we can to get a national awareness campaign going. So, and we need everybody's help in that mission. Anyone else would like to comment? Yes, please.
Can I? I'm Dr. Simi Ratan here.
Okay.
I'm a pediatric surgeon, and we have recently also worked on detection of sort of a auditing of birth anomalies that we are seeing in our hospital, inborn and outborn nursery as well as pediatrics ward. And we found that pediatric surgery surgeons are required to be attending to about 30 to 50% of all birth defects, and maximum of them is spina bifida to the tune of 25%. That shows the extent of problem. And I had also conducted one project in which it was detected that folate deficiency and vitamin B deficiency both are responsible for these defects, in which neural tube defects specifically and other birth defects in comparison to normal controls were assessed. And it was seen that there is a lot of genetic element also associated to cause these anomalies. We all know about the gene mechanism involved in folate metabolism. So I feel the fortification of food is the one area which has to be largely worked on, which will not only improve the maternal and child health, but also the health of the public at large. So I'm happy that Dr. Karmarkar has taken up this issue at a larger scale and brought it to the attention of the authorities high up. Thank you so much.
Thank you, Simi. Before Meera, Mrs. Gulati is with us. She's a mother of a person with spina bifida, Jessica, who's also sitting there. So she wants to say a few words, please.
I just want to say I'm very much thankful to Dr. Kamarkar, who has really helped me out with this problem. Actually, I was not aware of anything, but the only thing is through the newspaper, I contacted to him, and he's been the God to me on the earth, who has been helping me in this problem to come out with. Yeah, she's.
Great doctor. So just 2 words, please.
I don't know what to say. Say thank you to Uncle, Dr. Sir, who has organized such a beautiful.
Because of urinary infection, reflux, she is in renal failure, and she takes peritoneal dialysis every day herself at home. Looking at her, what do you think? That we can't have this. It's coming back. And soon
Thank you.
She might undergo some surgeries for facilitating transplant, which we'll plan one surgery in Mumbai and the other one either Delhi or Mumbai.
Yes, sir. So I'm very much thankful to Dr. Kamarkar, who has really helped me out with this problem which we have been facing for such a long time since she's been born. We were not aware of this anything. Even the doctors also didn't know about this problem, and I mean they didn't prescribe anything for us. And it is only in the newspaper when I read this article about Dr. Kamarkar, I just got in contact with him. So he's just been the God on the earth to me, who is going to help me to come out with this problem. And even I think she will be also doing much more better. Already she's been doing it. But because of this kidney failure, she's been lagging behind with number of things which she wants to do it. The only thing is we are hoping for the best in the future for her, so that she can also be. She's been doing law, and the second year, I think, because of kidney failure, she gave up everything. Even he knows also. But still, we have been helping her with all her problems and everything with the help of the doctors, I think.
Thank you.
Thank you.
For the next 6 months, our God is Dr. Kabra. I hope. Yeah, Meera.
What I wanted to say. Okay. So what I wanted to say was another important fact which we didn't touch is when you see a baby who's not been diagnosed and comes to us to get operated for meningomyelocele, paraplegia, or whatever, I take more time explaining that what can be done for this baby I take more time explaining for the next pregnancy. Please start. And I think we need to get our obstetricians very much involved, that let's start with the folate before you plan the next pregnancy, because their chances of having another baby is higher. And so the general public is so focused, and rightly so. The parents are so overwhelmed with the fact that they've got a baby with spina bifida, they've got something, and here is this doctor trying to tell us. So it's important to tell them to get to a person like Dr. Suresh and his colleagues, level 2 scan, get on the folic acid, and I think that's where we will make a difference. And then going, obviously, the fortification and this put together, we are going to pull the incidence down.
Again, devil's advocate as ever. Not many pediatric surgeons or neurosurgeons in Delhi, I've been in Delhi in a government hospital in a very high position for the last 25 years, are really keen to manage or operate this spina bifida patients. Very few people who would kind of accept these patients and operate. And things become worse if the patient at initial presentation has got paraplegia, hydrocephalus, neurological deficits of bowel, bladder. Those are the patients who probably get prognosticated at a very resident level and sent back home. Sure, because some of us senior people took interest, they'll be told about the next pregnancy, but the one who has come now to you is usually kind of, put in the trash. So some of us have taken interest. We have had comprehensive clinics. Dr. Deepak would remember Dr. Ajay Sharma from GB Pant Hospital used to do a lot of pediatric neurosurgery and a lot of spina bifida. So Way back in 2000, or a little earlier than that, we started a urology clinic for, his patients. I used to operate my own patients, but his own patients also would come to us, and we will provide them comprehensive care as regards the urology and neurogenic bladder management and augmentation and all that gamut of things that need to be done for those patients. So it's important that, all pediatric surgeons do all kind of birth defects. Some of us should take special interest in Spina Bifida, hydrocephalus. Way back, I've been going to Lahore a couple of times and other SAARC countries. Lahore has a dedicated pediatric neurosurgery department in Lahore Children's Hospital since almost 20 years. I mean, they have their theaters running every day where they would do at least 10 or 12 patients of spina bifida or hydrocephalus, which are referred from other places of Pakistan. So why can't a country much ahead of Pakistan do something like that in our country? I think we can do it.
Dr. V.P. Singh is the current president of the Indian Society of Pediatric Neurosurgery, a very eminent and just recently been elected as the president. So he has a great responsibility on the shoulder.
Right. So as doctors, pediatric surgeons, neurosurgeons, we are always firefighting. We are really sort of the problem has already happened, and we are trying to prevent one complication after the other. And we all know if the patient is paraplegic, if those nerves have not been formed, there's nothing we can do to correct it. We can only do firefighting and try to prevent further disability. So I think the focus has to be on prevention. And that is where we are going to help many, many more people than whatever work I do or you do or any number of pediatric surgeons do. I think we can help the community far more if we are able to get our message across. And I think supplementation has been tried. Many countries not shown to be fully successful. The only thing which works very well is fortification. And 1/4 of the population of the potential spina bifida patients are now in countries they have mandatory fortification, various things which actually works. They got demonstrated results in country after country where mandatory fortification has come in, and the number of incidents of spina bifida has dramatically reduced by 80%. It's not 100% reduction, but 80 to 85% reduction is documented. So, I mean, it's a little ironical. We have a problem where the children do suffer, and the children and the families do have problems throughout their lives. We have a solution which is easily available, which is easily doable in a safe manner, effective manner, what to fortify, that is a secondary thing. We can take it out. To my mind, iodine is the best. The salt is the best. Just like we've iodinated it and got good results, it's a simple thing to mix the folic acid in the salt. Everybody takes salt, whether you're in the north or south. So whether coffee, tea, wheat, rice, there are many things. Rice is a particularly bad example because when you wash the rice and you soak the rice, a lot of it goes away. But I think it is a moral responsibility that we take this forward and we do sort of talk about fortification, because we'll be helping many, many more people than the number of surgeries you or I can do.
And we have 2-3 more people whose comments we need to hear. Yeah, so I said we have 2 or 3 more persons in the room whose comments will be worth listening to. And I'm going to request Dr. Subhashis Saha, another senior pediatric surgeon, has worked and probably operated on hundreds of such children, spoken to hundreds of families. So his words, then Ms. Payden from WHO and Vivek Singh from UNICEF. So UNICEF has kindly consented and agreed to participate in this meeting, but he has been quietly sitting there. So he would talk. So first Subhashis, then Ms. Payden and Vivek.
Thanks, Santosh.
I think since we are discussing and debating many hot points in birth defects and their further management, prevention and further management. So one of the areas which we already discussed is early detection, and we all know that we are spreading the awareness for early ultrasound and early detection. The question is, what after the early detection? We run a fetal clinic where we see many pregnant mother with early detection of neural tube defect. The question comes, there is counseling and further management. I am aware that in some countries they have a very low threshold for termination to reduce the number of defects. And of course, there are literate parents who can take decisions regarding termination. But there are many parents, mothers here, who have no idea what happens to these babies. And so that's where the counseling becomes very important, and decision making, because there are no simple guidelines to take decision. Once you have even picked up, say 20 weeks, 24 weeks, you have picked up a spina bifida, what are the guidelines for the physicians and the surgeons and the obstetricians to decide what to do? So that is another gray area, would open up a big controversy. How do you make decision? How do you counsel the parents? And is there a way to reduce the burden of such bad defects which are not incompatible with life but can cause severe disability?
Yeah, right. In that context, a quick comment which all of you might find interesting. Earlier on, 15, 20 years back, it was a great dilemma what to counsel. And my view also was much pessimistic about these birth defects. My job today is very simple. If an antenatally diagnosed family comes to me, mother, pregnant, I say, we do explain all the pros and cons, but then I say, before taking a decision, please go and meet this family. Luckily, with the foundation's reach, we have families all over, and meet them, see how their child has grown, what they have done, and then come and talk to me and tell me whatever is your decision, we'll do. Believe me, almost all come back and tell me they want to carry on with the pregnancy. So I don't know. I mean, so you're talking of abortion and raising the limit. If these antenatally diagnosed cases meet a family like Jessica's, or we have so many, all of them come back and say, sir, we want to carry on. You have explained all the possibilities, including wheelchair dependence, but we will carry on. So that's something, some food for thought. Okay, Dr. Parveen Bhalla, a quick comment before Ms. Paden. Parveen has been working on fortification. Some of you probably know him. He's from Haryana and quite activist as far as fortification is concerned.
Yes, I just want to give a background that in 2016, when FSSAI came up with the food fortification standards, they were in line with the WHO 2009 recommendation, which most of the countries are following. But we are fighting this case since 2019 because FSSAI came up with another standards in 2018, October, where as Dr. Rajesh also mentioned, the level of folic acid and vitamin B12 were lowered more than 90%. And as Dr. Chatterjee said, there were a lot of concerns from the expert panel of FSSAI, and we were able to address all those concerns, but still they bluntly said our focus is only on prevention of anemia. So I was just mentioning to Dr. Rajesh that before changing the standards, we need to change the mindset of the expert panel.
Or change the expert panel.
Okay, Shilpa.
Regarding the point that you made with the washing of the rice and the folic acid goes away, of late the latest plan is to have capsules which look like rice. So it's a pseudo rice which is there and then that doesn't get washed away.
First you brush the make it or put some, and then again make it gray. It's like it is a nice process. I request Paden to say.
Thank you. I'm a layperson in this area, but listening to all the experts, I learned a lot today. I was also trying to remember when I became a mother 27 years ago, I was not aware of anything on this. Neural tube defects, birth defects, I didn't know about it. So I'm sure it is still, as we have heard also from other speakers, the awareness is very low. So it's really important to educate young women before they become, marry and become mothers. Really important to educate them. From my side, I have 3 daughters. So I'm committing to ensure that my children do not get into that and ensure that they take all the measures necessary to prevent NTDs. That's something that I was just thinking about it. So from WHO side, we have already heard from Rodrigo how we are also committed to support Dr. Sunita and all the other stakeholders in ensuring that we prevent. First, the most important thing is to prevent NTDs, and after that, then we take care of all those who are living with the defects to ensure that they live a healthy and dignified life. So those are the 2 things that I wanted to share. Thank you very much.
Vivek.
Thank you and good afternoon to everyone. I think this is an area where, speaking of the children's rights, we know that if born, they are going to be children with special needs, and if prevented, that's the most ideal thing wherever the children will have a challenge in their life. So what is important for us to note, I think Dr. Suresh also mentioned that in Tamil Nadu, with WHO and UNICEF support, the health department has launched a registry. Kerala has a vibrant birth defects program, and across the country we are seeing that the system's capacity is increasing to have a program for birth defects, as this also becoming a leading cause, the 4th cause in many states, even for the lives of the newborns being lost. But as Dr. Ghosh has mentioned, as a country, the newborn screening capacity across health systems in the states is increasing. And what is also getting strengthened is the preconception care as a program. India has a very strong newborn care program, which has emphasis on 6 intervention pillars across the life course, which begins from the preconception care. And Maharashtra, in fact, as a state, has scaled this program to all the districts, where the emphasis on the right timing of the folic acid supplementation and starting to talk to couples who have planned pregnancies. So I think as states take up this preconception care program strengthening, this will also be very useful. And on a personal note, I heard you talk about Dr. Godfrey Oakley, and I now remember that I earned my master's scholarship working with him on his folic acid project. So I will definitely share a note with him. And personally, as UNICEF, in the new 5-year program for India, which has begun on 1st of January, we have also strengthened inclusion of disability in the program and trying to reach these children with as many states as possible in the next 5 years. Thank you very much.
No, I just wanted to add one small thing, and that is, it is high time we also wrote out the right of the unborn child. And the right of the unborn child should include the right to be born without disability. So we are talking so much in UNICEF and other places about the right of children. I think it is high time we extended that to the right of the unborn child.
Yes, I would also like to continue with that same thought. When we talk about prevention and awareness with such vigor, sometimes we kind of stigmatize the disease itself or the condition itself. However, it's just another way of life, and if children do, they are born with the defect, then there are ways forward. We should not stigmatize them or deny treatment. We should just guide the families and make sure that they are given all the treatment that they deserve. And in an effort to bring down the incidence, we should not be so aggressive that we deny the right to these children. We see that Jessica is sitting in this room just like all the other children here. Especially to the newer generation, I would like to tell them that there are ways forward. And if you see that there is a defect, it doesn't mean that that child does not deserve living. And you cannot deny treatment based on whatever you feel is going to be the quality of the life of that child. There is a neurosurgeon who is the head of Michigan. She has Spina Bifida, and she's a neurosurgeon right now. And Sudhakar sir's daughter, who's working as a journalist. Now, these children have gone on to achieve things that anybody has achieved in this room. So I don't think we should judge and define what they should be doing in their lives. Just because it's an unborn child and somebody else is taking the decision, that decision should always be for the benefit of the child.
Exactly. I would like to clarify here, the amendments are not that say that do it, but women, if, with a substantial fetal anomaly which is not compatible with life. So that has been kept, and that also medical board has been kept so that they can actually decide that what the seriousness of the thing and how the woman's, how much safe it is. So that all this in consideration. The thing is, a lot of cases were coming, Supreme Court and all, and there are active lobbies, those who say that they should have rights to, but exactly what I say, that no one knows what will be the extent of the, disability after being born. So that is a very crucial decision, and which
Yeah. Yeah, ma'am. Actually, the medical board sometimes is very biased. The people in medicine itself have very high standards of the quality of life of a person. So many a times the decision taken by the medical board may not really be conducive for the child. So it's very relative there, I think.
women actually, wants it. So that is the thing. It is not same questions we faced. It is not to, deny the child the life. It is when because see, a lot of women, they today one child, two child, so they want it beyond certain gestational age. So that was why the law was amended, but nothing forced thing about it. That is the thing. It is their wish. That option has been given. Yeah.
Thank you, madam. So this dialogue can go on, but we need to end as well. So, yeah, okay, sure. You're also going to give the vote of thanks, I think.
Sir, can I just make one comment?
So, two more comments. One, Dr. Suresh.
Yes.
And we cannot go without hearing some thoughts of the students who have been sitting here. So, I'm going to request one or two students volunteer and say something. So, yes, there's one hand up. Anyone else? Okay. So, Dr. Suresh, then your name? Divyanshi. Okay. And then vote of thanks.
Okay, so this is a very important thing which we need to understand is antenatal diagnosis of birth defects. I agree that every child has a right to be born without birth defects, but antenatal diagnosis of birth defects is not 100%. We cannot diagnose all defects because it depends on the bodily habit. Several factors are there in the antenatal ultrasound, including skill of the individual, type of machine used and everything. So if we, and today in India, the maximum amount of medico-legal issues in the consumer court is against missing birth defects, including for spina bifida. Those who are missed it antenatally, huge amounts of compensation are being done. We learnt about 1 crore compensation being given out for somebody born without limbs. So while doing the awareness, must also ensure that people are said, while you can have antenatal checkup, there is a possibility that defects may not be detected also. This is a very important thing because otherwise the public goes with 100% expectation when the system can only deliver 70%. So this is a very, very important. Otherwise the number of litigations will just shoot up like anything. Simply because there are not enough trained people doing antenatal ultrasound. With 30 million births, every woman needs at least minimum 2 scans in the pregnancy, if you say so. if not 3. That amounts to some 60 million scans to be done, and there are only a handful of people who are experts in this. So this is a reality we have to understand and weave it into the message so that the public get the right message.
Okay. Thank you, sir, for giving me this opportunity. I want to say that the fortification of salt is the most uh, beneficial thing what I have learned today. And the another thing is awareness. Awareness is very less in our country regarding neural tube defects or birth defects. The many of the families which are very educated, they even don't know regarding this what we have to do if the child is born with birth defect, and how we deal with this situation, and the emotional support the family requires, which is very important. So we have to consider all these things. And the fortification of salt is I think most beneficial thing, because salt, everyone is using the salt in whole country, everywhere, world, everyone use salt. And the things, tea, many of the people are not using tea like as me. And many other things are also राइस जैसे कि किसी ने अपनी खुद ही फील्ड से ले रहे हैं, जो फार्मर्स होते हैं, दे आर यूजिंग देयर फील्ड राइस, देन बेनिफिट डोंट गेट, दे वोंट गेट दीज बेनिफिट्स, है ना. थैंक यू सो मच. थैंक यू एवरीवन.
Yeah, actually, I wanted to tell sir, my doctor suggested that we can end the life. I did not agree. Next day, one life was ended. In the same hospital, same doctor.
Individual.
Because we don't have any other alternative.
Yeah.
And during that time, we don't have any other. And even we asked her when she was operating, when she was operating, and they told us that the urine problem and the bowel problem is throughout the life, and we have an option. So we don't get the right treatment at the right time. Not only, I think in AIIMS it is maybe possible, but in other hospitals, even the guidelines are also not.
Okay, thank you everyone. So I want to highlight a point that like counseling, we have said a lot, and ma'am had said about like second child not having neural tube defect. So in this website, NCBI site, it is written that family history is 16.9. So if we can reduce that thing, that if first child or any familiar history of having NTD is there, so we have to make sure by counseling and other things that like that is very small step, but big action is there with this thing. This point I want to have.
So I wish to start before I start giving the vote of thanks, I would like to start with a small quotation that I am because we all are. And we started this journey with the Spina Bifida Foundation way back in 1990s. I represent the profession of pediatric physiotherapy. And we spoke of advocacy, we spoke of awareness, but as physical therapists, we speak of alignment. So I would like to state here that pediatric physiotherapy is very different. Many in the country, even professionals, are not aware of the type of physiotherapy which each condition needs. And spina bifida is no different. I thank heartfully Dr. Karmarkar to include us on the team before the surgery is done. He calls me to do a muscle charting. Post surgery, we again do the muscle charting and we start the therapy as early as we can. So alignment in terms of life, in terms of participation is very important. and research when it comes to what type of problems or morbidities the family and the children face is unknown in this country. When we look at research, there is no research on levels of obesity, levels of participation neglected. So I seriously want to say that the foundation has taken a positive step ahead today in aligning so many hearts, and I can see the hearts are all connected together. So I thank everyone. To begin my vote of thanks on behalf of the foundation, I thank all the dignitaries and the members in attending today's meeting in spite of their busy schedules. So a journey of the 1,000 miles starts with a single step. We all know that. But when many such single steps come together, we foster a positive change and a revolution. I hope today we have achieved that. I extend a very warm thanks to Dr. Bhagwat Karad, Minister of State of Finance, for his esteemed presence, who found time to come today for this meeting. I thank the entire WHO team led by Dr. Rodrigo, Mrs. Biden, and at this juncture, I invite Dr. Karmarkar to present a memento. We had missed Mrs. Biden.
Yeah.
Thank you. And of course, Dr. Deepti Agarwal, a big thank you to you. The team of AIIMS, All India Institute, led by Dr. Srinivas, Dr. Meenu Bajpai, and all others who have contributed towards making this a grand success. Dr. Shaumita Ghosh, Additional Commissioner from Ministry of Health, a big thank you to you, ma'am, and I'm sure you will take this ahead in aligning what has been discussed and taking positive steps to first, of course, create awareness and also see how we can not have many more kids who have participation issues. So I would next like to thank all the people who have participated. Dr. Sandeep Chatterjee, Senior Surgeon, Neurosurgeon, Dr. VP Singh, President of the Neurosurgery, Indian Association of Neurosurgery, Dr. Hemanto Datta, thank you, Dr. Suresh from the Fetal Medicine, Dr. Madhurika Kabra, geneticist, from the Birth Defect Registry, Dr. Tissani, who is a neurosurgeon, Dr. Pratima Mittal, of course she could not make it today, but a big thank you to her, Dr. Sudhakar, our chairperson, and Dr. Gupta. A very special thanks to Mrs. Uma Kalekar for her presence, her encouragement, and walking the way from day one. Dr. Rajesh Mehta, who is an ex-WHO officer and has definitely helped us. Dr. Parveen Bhalla. Dr. Sumira Ratan, who is a pediatric surgeon from MAMC. Dr. Vivek Singh from UNICEF, and Dr. Sareen, who is the president of IPS. And many others. If I have missed any names, please, I apologize. But I'm sure every heart here and outside who has not been able to participate is in this journey. And I would finally love to thank our founder, trustee, and chairperson, Dr. Santosh Karmarkar. And of course, Sneha, for all her efforts she has taken in making this endeavor possible. I am because we all are. Thank you.
In addition, I would like to thank our parents and Supreet, who is a Spina Bifida individual. Thank you all for spending this wonderful day over here. I hope this meeting has taken some initiative, and I hope we can take this ahead. Thank you. Lunch is ready. You can have it at cafeteria.